Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating study that explores the potential of using the lactate to albumin ratio, or L2A, as a marker to predict mortality in septic dogs. Sepsis, as defined by the Surviving Sepsis campaign, is a life-threatening condition characterized by organ dysfunction that is caused by a dysregulated host response to infection. In veterinary medicine, it's commonly defined as systemic inflammation resulting from an infection. Sepsis is associated with high morbidity and mortality rates. The study we're discussing today aims to determine which readily available biomarkers can be a helpful tool for diagnosis, prognostication, and therapy. In dogs suffering from septic peritonitis, mortality rates can range anywhere from 21% to 68%. And when septic shock is involved, those numbers can climb as high as 70% to 80%. That's why early recognition and intervention are so important. In human medicine, the lactate to albumin ratio has been proposed as an early and effective prognostic indicator for mortality than either lactate or albumin alone. High lactate to albumin ratios are associated with higher rates of organ failure and mortality rates in humans with sepsis and septic shock. To tackle this issue, Jules Hunke, Penny S. Reynolds, and Jacob Wolf conducted a retrospective case control study at an academic teaching hospital. Their work, Lactate to Albumin Ratio is Not Predictive of Outcome in Septic Dogs, was published in the Journal of the American Animal Hospital Association in 2024. The goal was simple: to see if the lactate to albumin ratio, easily calculated from routine blood work, could help identify high-risk septic patients early on. The researchers hypothesized that dogs in critical condition, facing death or euthanasia, would exhibit higher lactate to albumin ratios compared to those who survived. Now, let's break down the methods. The team conducted a single-center retrospective case control study, meaning they looked back at existing hospital records to analyze the data. They searched the electronic medical records for dogs diagnosed with sepsis between October 2012 and August 2021. They looked for a variety of terms, including bacterial sepsis, septic peritonitis, septic shock, septicemia, and even just unclassified sepsis. To ensure accurate data, the team set strict inclusion criteria. They only included records that had at least one venous blood gas analysis and a biochemistry panel performed either upon arrival or by the referring veterinarian. If there were multiple values recorded for lactate or albumin, the first recorded value was used. They excluded records with incomplete lab results, concurrent diseases, multiple surgeries before admission, a lack of diagnostics, missing vital signs, or incomplete blood work. The team collected a wide range of data, including signalments such as breed, age, sex, reproductive status, and body weight. They also gathered clinical assessment data like body temperature, heart rate, systolic blood pressure, and respiratory rate. Mentation, or mental status, was scored on a 5-point scale, ranging from normal to comatose. The team also collected hematology and biochemistry measurements taken within 24 hours of presentation, such as hematocrit, platelet count, white blood cell count, glucose, urea, creatinine, total bilirubin, chloride, lactate, and albumin. They noted hospital management details like length of stay, type of admission, whether surgical or medical, and the amount of fluid present in the abdominal, thoracic, or pericardial cavities. To get a better handle on the severity of each case, 4 scores were calculated: Systemic Inflammatory Response Syndrome, or SIRS, score, the Shock Index, the Survival Prediction Index 2, or SPI-2 score, and the Acute Patient Physiologic and Laboratory Evaluation, also known as the APPLFAS score. The SIRS score was based on temperature, heart rate, respiratory rate, and white blood cell count. Clinical suspicion for sepsis in dogs is the presence or suspicion of infection together with at least 2 out of 4 SIRS criteria. The shock index was the ratio of heart rate to systolic blood pressure. The survival prediction index 2 score predicted probability of survival. The APPLFAS score was derived from lactate, albumin, glucose, platelet count, and mentation. The study compared in-hospital mortality with the lactate to albumin ratio. The dogs were placed into 2 categories: non-survivors, including those that had cardiac arrest or were euthanized, and survivors, those that survived to discharge. Lactate, albumin, and the lactate to albumin ratio were the primary outcome variables being measured. The researchers used statistical analysis to compare the 2 groups, paying close attention to any factors that could skew the results such as age, sex, body weight, and SIRS score. They also performed sensitivity analyses to assess the robustness of their findings, considering missing data and mortality classification. So what do they find? Out of 190 records initially identified, only 143 met the inclusion criteria. Among these dogs, 49% survived to discharge, 37% were euthanized, and 14% experienced in-hospital cardiac arrest. Septic peritonitis was the most common diagnosis, accounting for 55% of cases, followed by unclassified sepsis at 20% and sepsis secondary to wounds or dermatological conditions at 10%. Interestingly, about 93% of the dogs with complete data met the criteria for clinical suspicion of sepsis based on the presence of 2 or more SIRS criteria. However, when the researchers looked at the lactate to albumin ratio, they found no significant differences between the dogs that survived and those that did not. The median lactate level for all dogs was 2.80 millimoles per liter, while the median albumin was 2.6 g/dl, resulting in a median lactate to albumin ratio of 1.22. The data showed that missing lactate and albumin data was not associated with mortality, but was strongly associated with whether or not hematology and biochemistry panels were obtained. Missing systolic blood pressure was unrelated to mortality, but strongly correlated with mentation status. Dogs with altered mentation were more likely to have their systolic blood pressure recorded. So, despite the initial hypothesis, the lactate to albumin ratio didn't prove to be a reliable predictor of mortality in septic dogs in this study. Now, let's consider why these results might differ from those seen in human medicine. In human studies, elevated lactate levels have been linked to higher mortality and sepsis. Similarly, in veterinary medicine, high lactate concentrations at admission in dogs with septic peritonitis often indicate poorer outcomes. Some studies suggest that lactate clearance, or how quickly the body removes lactate, might be a better predictor of survival than the absolute lactate level. However, it's important to remember that lactate levels aren't specific to sepsis. They could be elevated in any state of shock. When it comes to albumin, there's limited data in veterinary medicine. One study found that higher albumin levels before surgery were associated with better survival in dogs with septic peritonitis. However, another study found no such association in septic dogs, regardless of whether they underwent surgery. The lactate to albumin ratio has shown promise in human medicine as a more reliable marker than either lactate or albumin alone. Studies have indicated that a higher lactate to albumin ratio is associated with higher mortality rates in intensive care patients. However, other studies have found little prognostic value in adult septic shock patients in emergency admissions. These inconsistencies may stem from the fact that lactate and albumin levels change at different rates and times during the course of the illness. The researchers acknowledged several limitations in their study. The data was collected from a single referral center, which may not fully represent the broader population of septic dogs. Additionally, the classification of patients as septic relied on clinical diagnosis in the medical record, which may have led to the exclusion of some cases if the diagnostic codes were not used. Also, there was inconsistency in how vital signs and lab results were documented, making it difficult to calculate severity scores for many patients. The lack of complete records for systolic blood pressure and lab results made interpreting the shock index and survival prediction index, 2 scores, challenging. Missing data didn't appear to be related to patient survival, but rather to the decisions of individual clinicians. The researchers emphasized the importance of standardizing practices for triage documentation, diagnostic tests, and lab work to improve clinical decision-making and research. In conclusion, this study found no significant differences in lactate, albumin, or the lactate to albumin ratio between septic dogs that survived and those that did not. The authors suggest that larger, multi-center studies may be needed to further investigate the potential of these biomarkers in sepsis. They also recommend prospective studies to evaluate the clinical value of the lactate to albumin ratio in predicting mortality in septic intensive care unit patients over time. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.